Hello friends, myself Divya Gavit and my topic for today is androgens and related drugs. It will cover three subtopics that are anti-androgens, 5-alpha reductase inhibitors and the drugs for erectile dysfunction. Now one by one we will cover all of these topics into some details. So the first topic is anti-androgens. Anti-androgens. But what are these anti-androgens? So, these are the class of drugs that prevents androgens like testosterone and dihydrotestosterone. They are also known as androgen antagonists or testosterone blockers. They act by blocking androgen receptors or inhibiting androgen production. So, there are some drugs that also act as anti-androgens at any condition. These are first, superactive GnRH agonist that inhibits LH and FSH release and results in loss of androgen secretion. Second is ketoconazole. At high dose, it inhibits steroidogenic enzyme, that is testosterone. And the third is spironolactone. Drugs that have been clinically used as antiandrogens are first cyproterone acetate, second is flutamide and third is bicalutamide. So now we will learn these drugs into some details. Moving further, we will learn first about cyproterone acetate. Its mechanism of action is direct antiandrogenic action by lowering serum testosterone. Also, it has progesterone-like activity. That is, it inhibits LH, which cause antiandrogenic action. And the third is that it competes with dihydrotestosterone for intracellular receptor. Its uses are precocious puberty in boys, inappropriate sexual behavior in male, acne and hirsutism in female. The dose for cyproterone acetate is 2 mg OD. Now the next drug is flutamide. It is non-steroidal AR antagonist. Its active metabolite, that is 2-hydroxyflutamide, competitively blocks androgen action on accessory sex organ as well as on pituitary. Plasma testosterone level increases in male which partially overcome direct antiandrogenic action. This limits monotherapy. Use for flutamide is carcinoma of prostate. Its adverse effects are hepatotoxic potential, gynecomastia and breast tenderness. The dose for flutamide is 250 mg. Now the third drug is bicalutamide. It is more potent and longer acting than the first two drugs. The use of bicalutamide is metastatic carcinoma of prostate. The side effects are hot flashes, chills, edema, loose stools. It is better tolerated, thus it is less hepatotoxic than flutamide. The dose for bicalutamide is 50 mg OD. Now, our second topic for today is 5-alpha reductase inhibitors. So, these are the drugs that block conversion of testosterone into dihydrotestosterone. The name of these drugs are finasteride and dutasteride. Normally what happens is testosterone is converted into dihydrotestosterone. This is mediated by enzyme 5-alpha reductase. So, the drugs finasteride and dutasterides blocks the enzyme 5-alpha reductase and thus the testosterone is not converted into dihydrotestosterone. So, the first drug is finasteride. Mechanism of action is competitive inhibitor of enzyme 5-alpha reductase. Also, it selectively inhibits 5-alpha reductase type 2 isoenzyme. Uses are first benign prostatic hypertrophy and the second is male pattern baldness. So, in the benign prostatic hypertrophy, it helps to decrease prostate size and increases urinary flow. But the prolonged therapy is needed, that is up to 6 months. If not done, then its withdrawal results into regrowth. The second is male pattern baldness, that is, it helps to promote hair growth and prevents further hair loss. Pharmacokinetics is that the drug is effective orally and is metabolized in liver. Side effects are loss of libido, decreased ejaculation and impotence. Dose of finasteride is different in benign prostatic hypertrophy and male pattern baldness. That is, the dose for benign hypertrophy of prostate is 5 mg OD, whereas 1 mg OD is given in the patients of baldness. The second drug is dutasteride. It inhibits both type 1 and type 2 5-alpha reductase. It is also used in benign hypertrophy of prostate and baldness. Differentiating point is that the finasteride is selectively inhibits 5-alpha reductase type 2 isoenzyme, whereas dutesterides inhibit both type 1 as well as type 2 5-alpha reductase. So the third topic is drugs for erectile dysfunction. But what is the erectile dysfunction? So it refers to the inability of men to attain and maintain an erect penis with sufficient rigidity to allow sexual intercourses. Normally what happens? During sexual stimulation, the parasympathetic nerves are activated and sympathetic nerves get inhibited. Thus, it releases nitric oxide from corpus cavernosum, and due to this, smooth muscles are relaxed and the blood flow is increased. That is why penis gets rigid and erect. But in erectile dysfunction, this process is not forwarded. So, to treat this erectile dysfunction, some drugs are used that are phosphodiesterase 5 inhibitors, and the others are androgens, papaverine and prostaglandin. We will learn these drugs and their method of use in some detail. So the first drug is phosphodiesterase inhibitors. This includes the drugs sildenafil, tadalafil and vardenafil. What does these drugs do? So normally cGMP is converted into 5-GMP, which is mediated by phosphodiesterase inhibitors. But this action is blocked by these drugs that are sildenafil, tadalafil and vardenafil. Then we will learn sildenafil in some more detail. The drug is orally active. It inhibits 5-phosphodiesterase selectively and enhances nitric oxide action in corpus cavernosum. Adverse effects are headache, hypotension, dizziness, facial flushing and dyspepsia. Also, it can cause impairment in color vision and non-arthritic ischemic optic neuropathy. Drug interaction is the patients of coronary heart disease are contraindicated. Also, erythromycin, ketoconazole, verapamil and cimetidine due to the inhibition of CYP3A4. There are also other use of sildenafil that is used in pulmonary artery hypertension. The second drug is androgen, but these are effective only when androgen deficiency is responsible for the erectile dysfunction. Third is papaverine and phentolamine induced penile erection, that is the injection of papaverine with or without phentolamine is given in corpus cavernosum. And the fourth is prostaglandin, that is alprostadil. It is directly injected into corpus cavernosum by using fine needle. Comparably, it is less painful than papaverine.